Hi, everyone. Thank you for joining us today for an impactful webinar on navigating insurance verification to streamline your medical practice. I'm Neha Kiani, Learning and Development Manager here at Hedge, and I'll be moderating this webinar today. Over the past few years, I have been working closely with healthcare professionals and remote talent to help bridge knowledge and operational gaps, especially in areas that directly affect patient experience and practice efficiency. One such area that consistently arises is insurance verification and how it can either streamline the patient intake process or, if mishandled, create downstream billing issues and operational bottlenecks. This webinar is structured to address these real world concerns and to offer practical insights grounded in experience. Here's a quick summary of what we'll cover today. Next slide, please. A clear breakdown of what insurance verification involves and why understanding it matters. We also will be talking about different types of verifications and which ones often get overlooked. The benefits and feasibility of hiring dedicated support staff for insurance verification. A look into how it trains remote talent to perform this function with reliability and professionalism. And finally, a live demonstration of the verification process using examples of various insurance portals. We'll also end with an open Q&A, so feel free to drop your questions in the chat at any point during the webinar. If you have any concerns, any questions related to the content, please feel free to drop your questions. Now let's welcome our two very special guests today who bring both the provider and remote talent perspectives to this conversation. First, we have Dr. Juarez with us, a board-certified endocrinologist who runs a successful solo practice in Houston. She's also the founder and administrator of two large online communities, private practice physicians and endocrinologist Facebook groups, which many of you may already be part of. Dr. Juarez, I'd like you to share a few words.
Thank you, Neha. I'm really excited that we're finally able to discuss insurance verification. Just a brief background on my history. I started my practice 8 years ago, really just kind of jumped into it. And looking back 8 years ago, I really had no idea what I was doing. And I've spoken to many of you, in the last several years about a lot of basic clinical protocols that we should be doing that most of us have never been exposed to, and we somewhat depend on our billing company or other staff to take care of that so that we can do our patient clinical care. But what I've learned is I really need to learn this. I need to have staff who understands this well and can really do this properly, but I also need to have some basic understanding, whether it's just to make sure that it's being done properly, or if for some reason a staff member's out, that I can be the one who can go in and take care of the issues. And I'll have to say it's become even more important in the last couple of years to make sure that we understand insurance verification. 8 years ago, I could look at an insurance card, say, okay, specialist copay $40, done. But I think many of you have seen that there's been a big shift that so many patients' insurance now, even a simple office visit, is going to their deductible. So it's really important that we understand before the visit where where they stand, what their responsibility will be to our clinic, and so that we can get payment up front. Because again, looking back at my first 2 years in practice, when I look back at patients who did have deductibles who never paid, you don't get that money back, or it takes a lot of effort to get that money back. So you're really working for free. And I remember the first time somebody had a high deductible. When they came into the office, they said they couldn't pay it, and I didn't know what to do. And I quickly realized I have to say no. We knew what the responsibility was. We clarified it. We let the patient know, and we say, I'm sorry, this is what you owe. And it's up to them whether they decide to continue with the appointment or not. And that's okay. That's part of running a practice. And I think a lot of us are worried about what patients may think about us, bad reviews, but ultimately, this is your bottom line. This is a business, and you have to understand how you're getting paid and making sure that you collect that just like any other business would. And a few years ago, it's been about 4.5 years ago when I started with Edge. Prior to that, my billing company offered somebody who would do the verification on her own time, set amount per hour. So I paid her by the hour. I think she charged me for 10 hours a week, but I didn't have direct contact with her if I needed her real time. She did her work, on her own time. And so it was kind of difficult when she wasn't available for me to figure out what to do if a patient came in and said, oh, by the way, I have a new insurance, which tends to happen. So 4.5 years ago, when I started with Edge with a virtual assistant, I have to admit I was a little spoiled. Liba started with me from the beginning with my practice, and she just knew what to do, what to look for, and she would communicate directly with billing if there were some questions. But I really stayed out of it. And it's only been in the last couple of years that I've said, hey, can I get access to some of these sites? I think I should understand this too, just to understand it in case somebody has a question. And it's been eye-opening, and it's really interesting that it's not as straightforward as we'd like for it to be. I can look at something, interpret it one way. She can look at it, the same information, interpret it differently. We'll ask our billers as our tiebreaker, and they'll give us a third opinion. So it really is confusing, but we at least need to make sure that we're doing our due diligence from the beginning of the visit and not trying to chase money afterwards.
Yeah, absolutely. 100% agree. Thank you for sharing that insight, Dr. Juarez. And as time progresses, insurances are getting way more complex. So is the verification process, like you said. And for healthcare professionals to ensure that their revenue cycle is managed in the best way possible and the patient experience is also well maintained, we do have to ensure that the verification is done in a way which maintains integrity, accuracy as well. So thank you so much for sharing that. We also have today Laiba with us, who works as a remote patient intake coordinator with Dr. Juarez. Laiba has been part of the team for nearly 4 years now and plays a key role in managing the insurance verification process for the practice. She will be walking us through a live demonstration of how she handles insurance verification in a real world setting later in the webinar. So, Dr. Juarez, I would also like to ask you that from your experience running a private practice, how critical is it to have someone on your team who deeply understands how the insurance verification workflow works?
I think it's probably one of the probably the most important task that needs to be assigned. And over the years of having different medical assistants, it's a hard thing to explain to someone who doesn't understand the basics, which unfortunately is where our medical assistants tend to come from. You're the one teaching them, especially in a small practice that you're running, and you yourself can't really teach that person well either. And so to have someone who understands the lingo, the words, how to speak to an insurance representative when something doesn't make sense is super important. And I would say once that was given, but having somebody within the practice who you can directly communicate with, for me, made a big difference. Having someone remotely, having someone not directly related to the clinic dealing with it wasn't as useful for me. But here, if I have a question, I can directly ask Liba during the day, hey, what's going on with this account? I don't understand this. The patient has a question. So she can answer the questions directly. I couldn't do that with my previous medical assistants. They didn't understand much of anything. At the most, they might be able to look up the very basics of a copay, but they couldn't explain anything beyond that. So it's really helped me just collect up front. That's our number one goal, is to collect up front, know what the patient owes, give them the opportunity to know what their visit will be before they come in. And it's their decision whether they'll be able to meet those payment requirements or not, instead of coming in the office, having that uncomfortable conversation in the office. We actually take care of everything before the visit. So again, having someone within the practice who's able to manage all that makes all the difference. And because again, my front desk, putting them in that situation, it's uncomfortable. Plus, they often don't know how to explain it. And so that makes a big difference. And again, if there's a procedure that needs to be done in the office, I can let the patient know it looks like any testing we'll do during this visit will go under your deductible. The cost will be this. I'll send them up front. And again, I won't have done a procedure that may not be paid for. And try to chase that later. And as a physician, again, I know this seems like we have enough to deal with. Why do we have to understand at that level how to review verification? But again, it's just gaining control as a practice owner. I think most of us have realized you really have to know the ins and outs of every part of the practice. You want good, great employees to be able to do that, but you want to always be able to go back behind someone and check something and understand it. Or if you just happen to be the only one that day who can check this, that you can do that. For example, Liba recently was out on maternity leave, which was great for her. But I felt very comfortable with it. I felt no stress about it. Well, I did, but for this, meaning, I was still able to go in the portals, do some things myself, and felt comfortable enough that I wasn't just going to have weeks of not knowing what was going on with the practice. And overall, it does reduce overhead. Patients pay what they owe at the time of the visit. We have a really clear process. The verification is done 1 to 3 days before, and Liba will let me know if she needs a code from me so that we can determine the cost for the visit. That's all done before the visit. And we do our best to guesstimate what those codes will be. I know it can't always be done for every specialty ahead of time, but we have a pretty good system in place so that everything's done 1 to 3 days before. And so if the visit is going to go towards a deductible, the patient is informed via text the day before of the cost. And we ask them, please check with your insurance company if you believe this is incorrect. So again, when they do come into the office, they already know what they'll be paying. There's no question of, well, they don't want to pay this, they're not sure. That's been taken care of before, so the check-in process has been pretty seamless. And I do think the patients appreciate it. And of course, if they disagree or they think they paid somewhere else, again, depending on the patient relationship, we may consider that and wait to take a payment. But again, we have a clear system and we have a color coding system in our schedule so that once a verification is done, the color of that visit changes so that we know we can look easily at our schedule and see, okay, this verification hasn't been done, something's pending, or we catch HMO patient that we haven't gotten a referral for, or oops, this person's actually out of network, or oops, this person's insurance is inactive, and making sure all of that's taken care of before the visit.
Yeah, absolutely. Thank you so much for sharing that, Dr. Juarez. And yes, completely agree that for medical professionals to have someone as their support staff at the practice who really understands the nitty-gritties of insurance verification is super important to not just streamline their processes, but also for patients to avoid any unexpected or surprise expenses that they might incur later. If for patients, copay is something that they do understand, they would be willing to pay. But like you said, deductible could be higher in some plans, and patients might not be very happy about paying that amount if they're not communicated way in advance that this is an amount that you will be incurring for the procedure that you're supposed to be availing at the practice. So it's not just the support staff who should be aware, but yes, I completely agree that the practice owners and the healthcare professionals should have the equal knowledge as well.
And I think it's unfair I think I hear this comment quite a bit. Well, patients, it's their insurance, they should understand it. I think most of us realize that it has gotten very confusing. The whole insurance payment process, we do owe it to some degree to our patients to make sure that we're doing our due diligence and doing our best to try to make sure that we're fairly billing them and fairly alerting them of their cost. I think it's not as easy as saying, well, they should be aware, they should figure it out. It's too confusing. It's confusing for us, and I think we are the ones that do, to a degree, owe it to our patients to make sure that we have a good process so that they're not stuck with something that they may have chosen not to do.
Yeah, absolutely. That's so true. All right. Thank you so much for sharing those insights, Dr. Juarez. Let's proceed. Next slide, please, Fatma. All right. So, like we discussed, insurance verification can be deceptively complex. It requires not just knowledge of payer policies, insurance plans, but also the ability to actually handle ambiguity, troubleshoot denials, and communicate clearly, often under time pressure. So at Edge, we place a strong emphasis on building job-ready remote talent who can confidently take on crucial support tasks, including insurance verification. This is why talent is carefully vetted through a comprehensive screening process before being admitted into the Edge EDU certification program. This majorly includes core learning on US healthcare systems, insurance workflows, simulated patient scenarios, HIPAA and compliance training, the most important one, and soft skills development, including workplace ethics, time management, and cultural awareness. This model ensures that when talent joins your team, a healthcare practice, they're not just task ready, they're workflow aware and trained to contribute with confidence. Now that we've talked about the structure and the strategy behind the verification process, I'd like for you to see this in action. Next slide, please. I'll now hand it over to Laiba to walk us through a few life examples of how she typically performs an insurance verification task using multiple insurance portals.
Thank you
Over
for
to you,
that,
Laiba.
Neha. Thank you for that. Good evening, everybody. I am Laiba. I've been working with Dr. Juarez as a patient coordinator since the past 4 years. I've been with Edge for the past 4 years as well. I've been handling everything from patient intake to problem solving, and of course, insurance verification that we'll be diving into today. Um, Somewhere along the way, I've completed my master's from MMU. I have also become a certified nutritionist, and most recently, I welcomed a beautiful baby girl as well. So let's just say I've mastered the task of the art of multitasking. Just a quick disclaimer before we get this started. This is more of a general practical overview than a full deep dive into every possible verification scenario. Insurances can and they do get really complicated. So that's why we're only going to focus on the key portals today, how to use them, and how we decode the information that they provide. Next slide, please. So starting off with the types of insurance verification, we've got two main types. The first is what we call a basic verification. This is something that we do when a patient first contacts us for an appointment. So we start by confirming if their insurance is actually accepted by our practice. Next, we check whether the patient's plan is currently active and what kind of plan they're on. This can either be PPO, POS, HMO, Medicare replacement, Medicare Advantage, etc. This directly affects their referral requirements and network rules. So we just need to make sure if a referral is required, we do get that in before they're coming in for their appointment. The second level is advanced verification, which we also call eligibility and benefits checking. So with this, we dive into the patient's actual benefits like deductibles, co-payments, and co-insurance amounts. Next slide, please. So at our practice, we complete the insurance verification a couple of days prior to the patient's scheduled appointment. This really gives us the time to catch issues early and avoid any kind of delays or surprises at the time of their visit. And also it allows us to confirm active coverage and then check if they need any kind of referral or prior authorization for their appointment. Next slide, please. Next up, we're going to walk through some major verification portals that we use. Each portal is specific to a certain type of payer. For instance, we use Availility for Blue Cross Blue Shield. We use it for Aetna, Humana, Medicare, Curative, etc. United Healthcare, Community Health Choice, Cigna, and some others have their own dedicated portals. We will get into the detail in the coming sections. Next slide, please. We're now looking at some common portals that we use every day and how to decode the information that they provide. So starting off with Availility, Once you're signed into Availility, this is what their dashboard looks like. Since we're verifying their benefits, we go to the highlighted section that says eligibility and benefits inquiry. This prompt will take us to the next section. Where you have to fill out some basic fields. So starting off with the payer, you choose which insurance you're verifying from the drop-down, and then scrolling a bit further down, you get the next section, which is service information. Here you need to choose the place of service depending on where the service is being rendered, if it's in the office or if it's telehealth. And then you need to select the benefit or service type. For our practice, it's always professional office visit. And then once you're done with this section, you move on to the next. That takes you directly to the patient's profile. And here, the first thing that I check for is the deductible and out-of-pocket accumulations. Sometimes the patient might only have an individual deductible. Sometimes they might only have a family deductible. Sometimes they might have both. We will find out in the following sections why taking a quick look at this is important. And then I move on to the specific benefits. Next slide, please. Yep. And then I look for the professional physician visit. The first thing that I look for here is if the patient has a copayment. So in the first highlighted section, you can see it says office visit, and then under copayment, it says 30. So they've got a $30 copayment. And then I need to figure out if the patient is getting any kind of diagnostic medical procedure done or any kind of testing done in the office. This is specific to, I think, the doctor's specialty. At our office, we mostly do ultrasounds, biopsies. Dr. Juarez also reviews CGMs. So I need to figure out if a patient is getting that done. And then I move on to the second part that is highlighted. So it says diagnostic medical procedure. So we just need to figure out if that testing is included under copay or if that's going to be an additional cost. So it says 20% coinsurance here, which means that if they're getting any kind of testing done, that is going to be under their deductible. And once their deductible is met, it's going to be 20% coinsurance. So if a patient is coming in and they're getting an ultrasound done, they're going to have to pay a $30 copay and then an additional amount that's going to go towards their deductible. Next slide, please. And this is just an example of when testing is going to be included under copay. So you're going to see that it says $75 copayment, and then under coinsurance and benefit deductible, it's either going to say nil or it's going to say $0 per calendar year. So it's only going to be copay, and then testing is going to be included under that copay. They don't have to pay any additional cost. Next slide, please. Moving on to the next portal, we've got Cigna. Once you sign into the portal, this is what their dashboard looks like. You go to the patient's drop-down menu, and then it's going to ask you for some patient details. You can use a combination of these. You can just either do ID, date of birth, or first and last name and date of birth. Once you're done with that and you look up the patient, it's going to take you to their profile. Again, here, you need to select the network from the drop-down menu, depending on whether you're in network or out of network with their insurance. And then I take a quick glance at their deductible and out-of-pocket maximums and their accumulations. And then I move on to taking a look at their general benefits. Since this patient does have a remaining deductible and does have a remaining out-of-pocket, they are going to be responsible for some kind of payment. Moving on to the general benefits, when you click on See General Benefits, they're going to give you a list of benefits. Next slide, please. And then we're looking for professional services. Again, you need to see if the services are being rendered in the office or if it's a virtual or telehealth appointment. Once you're done choosing that, it's going to give you the specific benefits right here. So the first thing, again, what I check for is the copayment. As it says in the middle, it's going to be a $60 copay for the specialist visit. And then again, I check if they're getting any kind of testing done and if that's going to be included in the copay. So you can see under coinsurance and deductible, it says not applicable. So that means any kind of testing that they're getting done in the office will be included in the copayment. Another way of checking this is when you click on See General Benefits, it's going to give you a list and you can just go to Diagnostic Medical as shown in the next slide. So you can look for diagnostic medical. This means diagnostic medical procedures that are being done in the office. You're going to see it says not applicable under both coinsurance and deductible. So these do not apply and it's going to be only a copay for the patient. Next slide, please. Moving on to the United Healthcare portal. Once you're signed in, the portal looks a little something like the next slide, please. A little something like this. You choose the eligibility from the top left corner and then give them the member ID and date of birth. Once you're done with that, you go to the patient's profile. So with United Healthcare, since you've entered your NPI number and your tax ID number in their profile section, they will automatically determine whether you're in or out of network. But if you're not sure, you can just choose the network status from the drop-down menu yourself, and then take a quick look at their deductible and out-of-pocket maximums. If they have something remaining, they do need to pay towards their visit. Moving on, right below the patient's name, it's going to give you a couple of tabs. We go to the coverage section of the tab, and then it's going to give us some popular services coverage. We then look for the specialist visit. Again, this is one of the most common confusing things that we come across. You would usually think that if it says 0 under the copay, they're not going to be responsible for any kind of payment, but they are, because under deductible, it says applies and it's not met yet. And under coinsurance, it says 35% after deductible has been met. So their office visit and their testing, both of those things go towards their deductible. They're not going to have a copayment in this case. Moving on. So this is one of the cases where a patient does not have an individual deductible, but they do have a family deductible, and then they do have an individual out of pocket, and they do have a family out of pocket. They've met their family deductible and they've met their individual out of pocket. In this case, they're not responsible for paying anything towards their covered services until their deductible resets for the next calendar year. This also does get a little confusing because if a patient has met both their individual deductible and individual out of pocket, but their family maximums are not met yet, they're not responsible for paying anything. And in some cases, they will not have met their individual maximums, but they will have met their family maximums. In that case as well, they do not have to pay for anything towards their covered services. Next slide, please. Addressing some common confusions. As I've said before, sometimes the copay can be listed as 0, yet their deductible will apply for the visit. Sometimes they won't have a deductible. They'll only have an out-of-pocket maximum. In that case, their coinsurance applies. As I've mentioned in the last slide, they might have family deductible and out-of-pocket med, but their individual deductible and out-of-pocket remains. Even in that case, there will be no responsibility for the patient. And some common times when I need to call an insurance provider is when, so this usually happens with Availility. They do give you the amount for the total deductible, but under the remaining amount, it says remaining value not provided. So I do have to call the insurance provider, and you can find the provider services number on the back of the patient's insurance card, and they can help you with that. I also need to call the provider when I'm unclear on whether testing is included under copay or if it's going towards an additional cost towards their deductible and out of pocket. I think that's all for my part. I will hand this over to Neha. Thank you for your attention, guys.
All right. Thank you so much, Laiba, for that walkthrough. I think it's always helpful to see how theory translates to execution, and this was really well explained. However, I would also like you to ask, could you shed some more light on, for a practice who doesn't really have access to these multiple insurance portals and they're just relying on calling the insurance companies to get the benefits and the verification process done, what would you suggest that how beneficial it is to have access to these portals and run the process through it first and then call for anything that is confusing or missing?
I feel like it's really quicker as well. And
Hmm.
then they do give you the general outlook on the benefits, but if you really need something specific, like whether testing is being included or not under copay, I think you do need to call the provider for that. That's inevitable.
Hmm. But relying just on calls and not using portals at all is going to slow down the process a lot, right?
It is, yep, yep. Because I've
All
been on
right.
hold for like 30 minutes sometimes.
Yeah, that can be really crazy and time taking.
And
Yep,
Dr. Juarez, you want to add? Yeah.
you say 90% of the time it is relatively straightforward through the portals. And
yep,
I think I realize everyone has different EMRs, and some EMRs are better than others in providing
Hmm.
some of this verification. We use Practice Fusion. You can check the insurance, and I've tried it. I find it difficult to navigate.
I
And
find it very confusing.
yeah. And so
Yep,
we end up using the portals most of the time. And I know you call when you
yep,
really have to. You avoid it if possible, but sometimes it's just quick. Sometimes it is just easier just to have a final
yep.
answer. Or if the patient is questioning what we're
Yeah.
seeing, and that way we can have something documented that this is what we were told.
Yep. And sometimes when the patient is questioning where have you seen that it's going towards my deductible, I just share the screenshot of the benefit with them. So it's just easier that way.
Yeah, provides more transparency. Completely agreed. All right. I would now go ahead and open the floor for a quick Q&A session. If anyone has any questions for either Laiba or Dr. Juarez, feel free to drop those in the chat. Meanwhile, I'm just going to scroll and see if we have any
There's a
existing
question about
questions.
confusion between deductible and copay. Often we collect deductible and end up refunding as insurance states only copay needs to be collected, even though
Mhm.
deductible was not met. What I wasn't clear about that question, and maybe you can answer here in the chat to the person who asked, is are you verifying every visit? Because again, most visits don't go to the deductible. So are these verifications that on your end are showing that it's going to deductible, but then somewhere in there was an error and it ends up going to copay, or are you just automatically collecting deductibles for every patient no matter the situation? So if you're doing that for every visit, then that's not the way to do that. And again, it's always, I don't know if it's always better to be overpaid than underpaid, of course, but then it's a lot of extra work to backtrack. So I have not figured out a way to streamline. Again, if you have an EMR that works well with verification, you could check that and see if that's a quicker way. But we found that, would you say it takes about an hour a day to
Um,
verify?
I would say it takes 5 minutes on one patient at max,
Yeah. I mean,
not more than
and
that
some,
using a portal.
yeah, and follow-up sometimes are a little bit quicker because we see the
Yep.
pattern, but you shouldn't assume that everybody's visit is definitely going to deductible, because then yes, you'll definitely over collect. Like I said, probably 8 years ago, I'm making up these numbers, but in my head, I felt like 80–90% of the time it was just a simple copay and we didn't have to worry about
Yep.
deductibles, but now it's flip-flopped the other way. So yes, there are a lot of patients that have deductibles, but there's still plenty that have just a copay. So we don't automatically collect a deductible for everybody unless LIBA's verification shows, hey, this is something with this visit might be going to deductible. So our process is when she, 1 to 3 days before she does the verification, if it's just copay only, testing included, she makes note of that, updates the amount owed and done. And she'll also check and see if there's any balance or credit from a previous visit so we can make sure we try to catch that at this visit if we haven't caught it already. Now, if it's copay and testing goes under deductible, she'll send me a message just to see, do I think I'll do any testing? I'll reply back, if it's a CGM code or an ultrasound code that I think I'll do, I can make a pretty good guess what I'll do at a visit. So I can let her know, she'll calculate what she needs to calculate and let the patient know their visit cost. And then same thing, I get a message for the ones that go to deductible. So I wouldn't recommend collecting deductibles for everybody. And I know your message says all insurances have deductibles, but that's not been our experience. Just, yes, a high
So
percentage do, but the only way for us to know is to do this verification. And for us, that time spent in verifying really saves us time on the back end. The front end work saves us a lot of time on the back end because there's always going to be some discrepancies, but we don't have to reimburse a whole lot, and plus I feel like every time you have to collect that much, there's an extra little conversation with the patient that we'd rather avoid that conversation if it really is just a copay. So I'd be happy to talk to you later offline and, kind of look at how you guys are doing it. Like I said, we've done this now for 3-4 years, just this pretty similarly, and kind of we've got a pattern going and it's worked well for us. But yeah.
So this is why when I'm looking at the specific benefits, I look for the copayment section first. So if they do have a copayment, I then move on to checking if they're getting any kind of testing done. So when they first have a copayment, their visit is not going to go towards their deductible. You will know when their visit is going towards the deductible if the copayment is stated as 0.
And if your clinic policy is we're just collecting deductibles with everybody because that saves us time and we'd rather just pay back on the back end, that may just be what works for your clinic protocol. But I know for us, we have enough patients whose visits go to a copay that wouldn't work and for us. So I feel like what we do works pretty well. I'd say 90% of the time our visits are pretty much paid as they should be at the time of the visit on check-in, and that's something we try really hard to do. But again, no matter what, there's always going to be some discrepancies. And so there are some verifications. We'll make a note. We'll say, go check the EOB in 2 to 4 weeks, and we'll go back and look, hey, we were confused about this, but how did this play out? And if the patient does end up having a credit, which we tell billing, they usually catch it before us. We tell them to go ahead and credit them back, or if there is a balance, we actually try to get it back from them instead of waiting for billing to send out a statement, because patients notoriously will ignore that. So I actually have my in-person staff or LIBA actually call and say, hey, that last visit, we have a balance. Would you like to pay that now? So that actually helps speed up things on the payment side.
Yeah, absolutely. Thank you so much for sharing that, both of you. And going back to what Dr. Juarez mentioned about certain EMRs or EHR systems that allow you to check insurance, usually that is for just checking eligibilities. For example, Athena is one of those EMRs where you can check the eligibility of insurance just on that system. But when it comes to checking the benefits for different procedure codes, you absolutely do need to access either different insurance portals or directly call the insurance companies to get that information. We do have another question. Yeah.
So there's a question, is there a way to streamline the process? Do we have to do this on every patient? Yeah. Unfortunately, I have not found a way to, any other way. And if someone has something to share, I'm happy to hear it. But, I went for a testing like at Houston Methodist, huge hospital system, and I'm sitting there waiting for her to verify my benefits. Guess what she's doing? She's calling Blue Cross Blue Shield. No, she was trying to get on Availility. She couldn't get on because it wasn't working. So she had to call Blue Cross Blue Shield. Me, in the meantime, I texted Live. I said, hey, can you run my insurance and just, send me the information? And, and I kind of showed the lady at, at this big hospital system, hey, this is what we found. And, in the meantime, she was on the phone for 15 minutes, getting the same information. So I don't know that I was really surprised. I assumed big systems had a much better way to streamline this. And I wish there was, and I'm happy to hear any recommendations if there is, but I haven't found it.
We have another question. So it says if testing ultrasound has no copay but deductible, then what is the payment? Is it usually Medicare allowable rate for CPT?
So I love this question because this is another like private practice 101 that we should all have done on day one is your, now I'm forgetting what it's called, your allowable rates with every insurance.
Fee schedules, yeah.
Yeah.
Yes, thank you. The fee schedule. So that's, that should be something we have down first day. So if you're doing an ultrasound, it's a Blue Cross Blue Shield patient, you should be able to look at your fee schedule, have a nice spreadsheet, say, okay, Blue Cross Blue Shield, ultrasound code, this is the amount. So it shouldn't be a guessing game. And I understand sometimes at the beginning, you're not given your exact rates, but you really have to push to understand your rates because again, this is what you have to collect because that's what you're getting paid. Now, if you've been doing it long enough and you're not sure what your rates are, you can go back and look at your payments with each insurance and build your fee schedule, kind of working backwards. But it's not, the question says, is it usually Medicare allowable rate? It really depends. I have some that pay me more than Medicare rates, some that pay just the same amount, some that pay a little less. So for us, there's not even a question of how much is the cost for that visit if something's going to deductible. All I do is I give on the patient message, she tells me whatever copay, coinsurance, deductible. I give her the codes. I don't think about it, and she looks at what the insurance is, and figures out the allowable. So I think that's very, very important that as a clinic, you really have a fee schedule clearly outlined for all the insurances that you take.
We have another one. Which EMR is the best to get to streamline insurance verification, the process, especially for beginners?
I don't know the answer. I've only been using, I've been with Practice Fusion for the whole 8 years. And, I don't know. Unfortunately, I'm not sure if there is one EMR that does it well and easily. And I'm happy to hear anyone else, or I can get back to you if I hear anything else, or we can ask in the Facebook group if anyone has any input on that. It seems like most people use it for verifying active or inactive, but I'm not sure if any of them do much more than that.
Yeah, one of them would be Athena, but yes, for any detailed verifications, you will have to access the portal or call. We have another question. How you obtain prior authorization if a patient comes in emergency? So if there's an emergency procedure to be performed or the appointment to be scheduled, how do you obtain the prior authorization for it if it's applied?
So
I think we can. Okay.
Go ahead, Liva.
I was just gonna say that we don't really schedule patients on an emergency basis because I think Dr. Juarez's practice is not really related to that. And we don't work on emergency CPT codes, do we, Dr. Juarez?
I don't, and again, I'm endocrine, so that issue doesn't come up. But if somebody is added on same day or somebody walks in and we decide to schedule them, for us, it's, again, we follow the same process of checking the verification. But I think maybe you mean getting pre-certification maybe for a procedure, which the insurances I have, I really don't have to get any type of pre-certification. So it's like a third level of verification that unfortunately we wouldn't be able to cover today.
So in case of where a practice is, performing any emergency procedures and patients are showing up, there is a process called retro authorization. So it's for specifics for emergency services only. in case where prior authorization may not be obtained from the insurance company of the patient on timely basis, then there is always a retro authorization that can be submitted after the visit.
And there's a question about if I decide on the spot to place a
Mhm.
professional CGM, do you verify before placing the CGM? Now, again, assuming they have the correct clinical diagnosis that would support it, LIBA's verification has already told me if that will be covered under the copay or not. So it's kind of already, the information is there. So I can look back at the message on the verification and see, oh, this testing is going to go to your deductible. And I may mention that if we decide to do this, this will be the approximate cost based on your insurance and your deductible. So I'm able to look at that without going back and checking again. And the other question about when copay is only a percentage, like in Cigna, but not an absolute number, then what's that a percentage of? Again, it's a percentage of your allowable rate. So we all have different rates with our insurances. So if Cigna pays me $100 for 99214, so usually the percentage comes up. Percentage I think of as co-insurance. Maybe I'm misunderstanding that. So percentage is a co-insurance, which typically means they have to meet their deductible first. And
Yeah.
then it's the percentage of your allowable rate with that insurance. Is
Mhm.
that how you're interpreting that, Liba? I think that's.
Yep, and that's why we
Yeah.
have that fee schedule for different codes for the office visit 99214, and then the ultrasound is another code. That's why we have that fee schedule. That makes it easier to determine what the total cost is. And then if you're seeing it's 25% co-insurance, then we determine what 25% of that cost is going to be.
And we have a system that for all our patients, all paperwork has to be in before we schedule for new patients, including the insurance card front and back, because the back of the insurance card doesn't seem important until you have to call them for information. And so that is important to have that. Sometimes you can get the card through the different portals if you just can't get the patient to send it in, but otherwise, it is that we make sure we have the actual card. And sometimes just looking at the card itself, it's clear it's an HMO or requires a referral. And I've learned my lesson. It is really difficult to get a referral the day of. So we've learned not to even schedule the patient until the referral is physically in. The patients will tell you, I'm going to see them tomorrow. They'll get it in. Just put me down. And and it's more work than we want to do. And so we've decided, okay, the formal referral needs to be in before we'll schedule, because my billers have told me if the formal referral's in, I can't even keep the copay. I don't know if that's correct, but I've been told, but they will reimburse the patient their copay, and I don't get paid for the visit by the insurance because the referral's not up to date. So we have made it a big point to make sure that the referral is in. And you can look in Availility if there's a formal referral in the system if you wanted to. You have to put extra data in, but you can see that.
We have a question. At what portals are used by Edge for verification of insurance? So we at Edge, we do not really have access to insurance portals. However, for healthcare practices that we work with, we do have trained staff in our learning and development team who can help them set up the credentials and login for those portals. We do cover the basic navigation of all the portals that were displayed in this webinar during their certification program with us. However, for the specific training on portals, we can help A with the access setup and B with the navigation as well, once the talent has been selected by the healthcare facility. Another
And
question that we have, yes, go ahead.
I just wanted to mention, I did, again, with the training that Edge provides, for example, when there's a substitute, if somebody's out for an extended period of time, if there seems to be a little bit of a gap in knowledge, I don't have to be the one to go in and train this person. I can ask my Edge, customer service manager, hey, can you please help out? Can you please talk to them? They need a little bit more training. And then it's out of my hands. Somebody else takes care of that additional training, and then they come back to me kind of updated with what they need to know. So it doesn't take away from my time, because again, I'm small. I don't have a practice manager. It's just me. So anything extra I have to do, I don't want to, basically.
Yeah, it basically extends their support post start date with customers as well. So if a healthcare professional reaches out to us, a provider is, struggling maybe with their talent, they need some sort of additional support. We are always here to provide that. We have another question. So do you always verify CGM code for a diabetic patient and ultrasound code for a thyroid patient in advance, whether you may or may not perform the procedure? Is it better to just have that ready in case we decide?
The verification that LIBA does, it automatically would give us that information about, again, it's all it is testing under deductible. So we're not verifying the specific code itself or the ultrasound itself. Basically, LIBA's verification is letting us know if any testing is done, it's included in the copay or it's not. And then that information is there so that if I do end up doing either of those things, we already know what to do. So most of the time I know before the visit if I'll probably do one of those things. And so she's already accounted for that. But let's say the day of the visit, I decide, oh, I think I feel something, I need to do an ultrasound. I can look back at her message about, testing under copay or testing under deductible, and I can let the patient know, oh, it looks like this will go to your deductible. So this will be X amount. And I feel weird to do this, but I'll send them up front to pay and then come back. Just to make sure that I'm paid.
Yeah. All right, we have another one. Is there a way to know when patient come to your office came from home and not from acute rehab? I have been burnt a few times when patient came from rehab, brought by family, and Medicare denied the claim.
I have not somehow come up with this. Every once in a while, I'll have a patient try to do a telemedicine from the hospital or from some type of place like that. So it's obvious that's where that's coming from. But I don't know how you would catch that except to ask. I don't know, Liba. I don't think we've come up with this issue.
No, we haven't.
All right. We did receive another question. So it says, how can a provider verify Medicare coverage and co-insurance for specific services when the practice does not have access to an online portal and representatives over the phone do not provide complete information?
I think if you don't have access to a portal, the only way would be going back and forth with the insurance provider. You're gonna have to call them again and, ask them again and again what the benefits are, because there's literally no other way to figure out.
Yeah,
And
you will have to call maybe twice or thrice and get someone like
Unless you
another
want to submit the
representative.
claim first and then collect the balance later, unless you want to do that.
something else I wanted to bring up, and unrelated to
Mhm.
that, because I don't know the answer to that one, but also I think it's important just to understand deductibles and knowing how to look on a website or portal and understand
Mhm.
it. Sometimes at the end of the year, I have messages say, hey, can we see this patient in December instead of January? I mean, let's be real, like patients have high deductibles. So if they need a 4-month follow-up, but 3 months lands you in December, they met their deductible. Let's get them in, get it done. So if you understand some of those things, I think most of us have that painful experience in January where it's slow, people have high deductibles, they don't want to come in. But if you notice, people are happily coming in December because they've met their deductibles. And I think, let them take advantage of that. So we do sometimes make a note. Before we even contact them to schedule an appointment, I'll ask Liba, can you double check their verification, see if they met their deductibles, even out of pockets, because hey, let's get them in, while they've paid into their insurance fully. And so I think these little things do help to just navigate your practice a little bit differently so that you can make the most, collect the most without maybe putting that extra patient burden. The one other issue that comes up quite periodically is patients say, well, I have met my deductible. I was just in the hospital. I was whatever happened. But the portal isn't showing that. Even if you call, it's not showing that because wherever they had their whatever they had, they haven't processed it. They haven't submitted it. So we do make a point to hold on to that and not collect. And then I'll have Liba recheck in 2 weeks, 4 weeks and ask her, hey, have they met it yet? That way, we're not the ones responsible for collecting that full amount, because a patient feels like, well, I've already met it, paid it somewhere else. And, so it's a little confusing there. So you do
Yeah.
have to kind of think about things like that, just because if you just submit it as soon as you saw that patient, it's on you then. It doesn't matter that you saw them after their hospitalization. You're the first to submit it, so you're responsible for getting that deductible. So these are just like little tricks we'll do, and I think a lot of clinics do that to just make sure that we get paid. And it's always better to get paid by the insurance than having to force the patient to pay if possible.
Yeah, these tips and tricks, they only come with experience and practice. We have one more question. So is there a way to know patient is enrolled in hospice, Medicare denies claim, and then you have to resubmit claim again with hospice modifier?
I have not come upon this, so I don't know how you would know without just the history there. I'm not sure. I don't think there's anything in the portal or Availility that would indicate through the Medicare site, through Medicare information, that that's the case. And it seems like maybe you have to, I don't know how you would think to, you may have to think to ask certain patients, wait a second, you mentioned this, are you enrolled in X, Y, and Z? I'm not sure how else to avoid that situation.
Right. Seems like we do not have any more questions and we are on time. This was really helpful, a very productive and insightful session indeed. As we close, I just would like to thank you once again. Incredible speakers that we have today, Dr. Juarez and Laiba. Thank you so much for sharing so much insights with us. I'm sure this would be helpful for many other healthcare professionals and practices out there. And we hope that the webinar was able to provide you all of very much clarity and confidence in understanding the verification process and dealing with its complexities. The recording of the webinar will be shared in Dr. Juarez's group and everyone who registered for it. Thank you so much, you guys, for joining in. Have a great rest of your week.